The Connecticut Hospital Association is pleased to present the 2024 John D. Thompson Award for Excellence in the Delivery of Healthcare Through the Use of Data to Hartford Hospital for its Adult Kidney Transplant Program.
I was placed actively on the transplant list, thinking I'm a couple years out. Wasn't anything that I was expecting at all. We were home watching TV, and I got the call. And initially, I was lost for words. I didn't respond. The young lady on the other end had to ask if I was still on the line. So it was a very short distance between the time that I became active and the time that I got that phone call. And the journey began there.
Transplantation is one of the unique fields in medicine where the desire to help the patient is at odds with our availability. The team's goal, of course, is to do more transplants, to get more patients to where they want to be, back to good health, back to a normal life. But there are way more recipients waiting for organs than there are available organs. And so the challenge is, how do you get those organs into the right recipients?
I think the fundamental issue here is that when you look at patients on dialysis, their health is poorer than patients who get transplanted. So transplantation is better than dialysis every day of the week, all the time.
And so we then started to look at, okay, where were we taking organs from? And tried to figure out better pairings. How could we do them and sort of maintain the same excellent results that we'd been used to having? And that was really the challenge. And that's where we had to look inside our own data to find out, well, where are those opportunities?
When you're looking at information that comes to you, there's a tendency for us to silo it in a way that makes us as practitioners comfortable, when the reality is that we should let the data tell us how we should behave. There are a lot of sort of truths that have been out there in the community for a long time about which organs work properly or which organs work well, which patients do well over time. But what we've realized, there is much more leeway in terms of using organs some may consider to be, quote unquote, they not good, but the reality is that patients actually do better.
Mining the data to sort of look at our list and to sort of look at those lists on a weekly basis, to have the entire team, every aspect of that, and every team member sort of chiming in. Okay, who are these people? Who are those that could take advantage of an organ that may be passed over by other programs in New England or anywhere in the country for that matter? But we have patients that may be further down the list. They may actually be below hundreds or even thousands of people, but that would be an ideal person for this organ to go into. And so that's the sort of thing we're doing on a literal daily basis.
I think it's very rewarding to know that the data that I'm providing on a daily basis over time is leading to our outcomes and success in transplant. We're listing people faster, we're transplanting them faster, and they're thriving.
I had my transplant on December 22nd of 2023. Here we are 4 months later, and I'm able to cook, I'm able to clean, I'm able to shop for my family, I'm able to do the things that I was doing even before dialysis. And to know that there are individuals that are working behind the scene to increase the chance to give people a second chance at life, it's just heartwarming. It's medicine at its best.
You know, for patients, it's an incredibly exciting moment. And so it's incumbent on us when we do that, that we actually are giving them the best chance for success.
So we're offering more and more transplants. We're doing more and more transplants, but we're maintaining the excellent outcomes. You know, that's the true reward for our team, I think, to see that change happen before your eyes.
I guess I could just thank them for more life. At the end of the day, it's more life. It is something to look forward to. More freedom, more independence. There are no words to express how grateful I am, because without Hartford Hospital, without their trained professionals, I wouldn't be a success story. I wouldn't be here today. And just thank you. Thank you. Thank you. Thank you.